Let's go over directional terminology. Directional terminology help us relate the location of one structure to another. First term is superior versus inferior. So along the midline of the body, this is the midline of the body, superior means toward the head, inferior means toward the feet. For example, the nasal region, right here, the nose, is superior to the oral region. The cervical region is superior to the thoracic region. What about the abdominal region to the thoracic region? It is inferior. Remember, we use superior and inferior only in the axial division of the body, meaning we can't say that the knee is superior to the ankle. We have to use another term for that. So for the appendicular division of the body, where we have the upper and lower extremity, we use proximal versus distal. Proximal means closer to the point of attachment of that extremity. So the hip is the closest point of attachment to the lower extremity, whereas the shoulder is the closest point of attachment to the upper extremity. So for example, we have the ankle is distal to the knee, whereas the knee is proximal to the ankle. Why? Because the knee is closer to the point of attachment than the ankle. Another example, the hip is proximal to the knee, whereas the knee is distal to the hip. Another example, the wrist is distal to the elbow. The elbow is proximal to the wrist because the elbow is closer to the point of attachment than the wrist. Moving to the third term, which is anterior versus posterior. Anterior is also equivalent to ventral, whereas posterior is equivalent to dorsal. Anterior means toward the front. So this is the anterior aspect of the body. Posterior means toward the back. This is the posterior aspect of the body. Moving to the fourth term, which is medial versus lateral. Medial means toward the midline of the body. So this is the midline of the body, whereas lateral means away from the midline of the body. So this is the medial aspect of the lower extremity. This is the lateral aspect of the lower extremity. Right here we have the lateral aspect of the upper extremity. That is the medial aspect of the upper extremity. Another example, the nasal region or the nose is medial to the eye. The ears are lateral to the eye. So the ears are away from the midline of the body. The eye is medial toward the midline of the body. Another example, the pinky is medial, whereas the thumb is lateral. Why? Because the pinky is closer to the midline of the body, whereas the thumb is away from the midline of the body. Moving to the last directional terminology term, which is superficial versus deep. Superficial means toward and close to the body surface, whereas deep means closer to the interior of the body. So for example, the muscle right here is superficial to the blood vessels and nerve, whereas the blood vessels and nerve, they are deep. They are closer to the interior part of the body.